12 girls.
It's just a burden that just gets lifted right off you. It's like being reborn.
Had I not been given the gift of life, I would have basically been unable to work. I wouldn't have been able to go anywhere or do anything.
This can happen to anybody. Your kids, my kids, our grandchildren, our neighbors.
Thank God we got this place.
I think the creation of the Transplant Institute will immediately catapult the Transplant Institute in Toronto to the upper echelons of international transplantation.
Multi-organ transplant program at the University of Toronto, soon to be the Transplant Institute, is very well recognized and very well respected internationally.
There are very few places in the world that have the capacity to provide the strength of basic research and the capacity to translate that basic research into practice.
The MOT has been at the leading edge in transplant research worldwide almost from the beginning.
When I started, some transplants, liver transplants, intestine transplants, for example, were barely achievable. And today, they're almost routine.
I'm very proud of the work that we do within this program. We offer exemplary care to the patients and to their family members.
With the establishment of the Institute, there is a tremendous opportunity. First, we can create clinical care programs which will lead the world. Secondly, we need to recruit the best and the brightest individuals. Thirdly, we want to be able to commercialize and to enrich the financial future of Ontario.
It will be this collaboration that brings like-minded people together in such a way that you feed off of each other.
We're working together to propel this institute to become the best institute in the world.
Hey Steve, are you nervous?
Yes, I am.
Just yesterday, actually, we had a young boy who received a heart transplant in March throw out the first pitch at a Toronto Blue Jays game. And what impressed me particularly is the little kid ran off the field full speed, and I thought, if it weren't for the heart transplant, he couldn't do that.
Living Donor Paired Exchange is a program which is in the process of going national that allows us to use living donors that were previously incompatible with their recipients for the purposes of transplantation.
The two institutes, the two adult kidney centers, UHN and St. Mike's, started this in Canada a number of years ago. We were the first to do this.
It occurred to me that I had 2 kidneys and I only needed 1. And then I couldn't think of a good reason why I wouldn't do it.
Instead of them giving an organ to one patient and facilitating only one transplant, we now have a means where their deed can facilitate the transplantation of several.
To find out that 8 people were going to have benefit from it was like the icing on the cake. It was great.
We have one of the strongest lung transplant programs in the world here. It means that we can use lungs that other programs in other parts of the world wouldn't consider using.
Over the last decade, we have doubled, tripled, and quadrupled the number of lung transplants we perform per year directly as a result of our research in understanding the process of lung transplantation.
I had probably about a 22% lung function, which is not very much. Large lung capacity, but couldn't function with it. And I was out of breath in no time at all. So the slightest little chores that people take for granted every day, like taking the groceries in from the car, couldn't happen. You can explain one way, is to put a straw in your mouth and try and breathe through it.
Toronto ex vivo system is a technique where we actually take the lung out of the body and put it on a system where you can keep it at normal body temperature, keep it alive, and allow it to begin healing outside the body before you transplant it.
It was on one of my clinic days that we come in, and the doc come in and he talked to me. He says, you know, there's a new procedure, and they'd want to try it out on me. Was I willing to do this? And they explained it all to me, and yeah, I was willing to do this. I didn't know at that time that it was a world first.
So that is a total paradigm shift in transplantation. We got a system that doesn't add more injury. It actually protects the lung. It looks after or maintains the lung outside the body, so it can start to heal and we can help it to heal. Andy got lungs that we couldn't have used without that strategy we developed.
I came out of the intensive care unit. They put me up on the ward. The next day, the physiotherapist coming along, she says, you know, do you feel like getting up? Can you get up? I said, yeah, I've already been to the bathroom. I said, do you want to go for a walk? Sure. We went for a walk and boom, right away you knew there's a difference. You could breathe. I go for walks with our dog. I go into the malls with my daughters now, which I couldn't do before. I do everything.